All right, Dr. Neil Nathan, thank you so much for being a guest on the podcast. I'm really excited to interview you today about mold-related illness, sensitivities, and all the topics that surround that.
Okay, well, thank you for having me.
Aw. Well, I always love to start the podcast with just hearing kind of what got you started in going down this whole rabbit hole of identifying what was going on with a lot of your patients that were dealing with mold related illness and what kind of opened your eyes to discovering this whole new world of patients dealing with this condition.
Well, that story goes back to medical school, where when I went to medical school, I actually wanted to be a healer. And I thought that I would learn how to do that in medical school, and I was a little bit disappointed that I learned to be a medical technician in medical school. But healing encompasses a whole lot more than that, and that wasn't part of the curriculum. So when I left medical school, that's when my real education began, and try to learn as much about health and the different ways of looking at it and the different approaches, which included the kind of cliche of mind, body, spirit, but all of that. And I was interested particularly in the patients that my colleagues didn't know what to do with. For some reason, this little bit of a detective in me, I really felt gratified when I could help someone who'd been to major medical centers and had all kinds of workups and still didn't even have a diagnosis, and they weren't getting better. I really enjoyed using the kind of toolbox that I had acquired by studying a lot of different things in healing to be able to help those people get well. So over the years, although I started out as a family physician, I delivered babies and did the whole family practice thing, my patients often were referrals from my colleagues who didn't know what to do with the people that they were seeing. And over time, I became a pain specialist, learned a lot of techniques for dealing with pain, and back in the 80s, we were seeing a weird condition which was then called fibrositis, which we now call fibromyalgia, in which people had pain all over their body and fatigue and couldn't sleep and had cognitive impairment and GI symptoms. And again, it was a real mishmash of symptoms that nobody was putting together. And when that happens in medicine, often people get labeled as, well, it's in your head, because nobody could have all of those symptoms. But when we tried psychotherapy or medications for that, it didn't work at all. So it was obvious that these people had a condition that we just hadn't figured out yet. And over the years, we began to learn a whole lot of biochemical imbalances that triggered fibromyalgia and chronic fatigue. And as we got better at treating it, there was a whole other bunch of people who had those symptoms that we still weren't figuring out. And so it turned out that a lot of those people had Lyme disease or co-infections. And later on, we discovered mold toxicity as a major player. So sorry for the long discussion, but this was a slowly evolving understanding of illnesses that we had not figured out, didn't have names for, and now we do. So over the years, we've learned a tremendous amount about how to both diagnose and help those folks. And that's kind of been my life work.
That's amazing. That's absolutely amazing. And no, I love this story because, I mean, nowadays when somebody, you hear about mold illness everywhere now. Like you hear about it, and at least on social media, there's a lot of people talking about it. We see a lot of articles written about it now. So it's interesting to imagine kind of a time where it wasn't talked about at all. It wasn't even, no one knew what was going on with a lot of patients and the wide variety of symptoms that they were experiencing. So I could imagine it was very troubling to a lot of practitioners such as yourself that you were probably trying to do all the best remedies that you knew to do, and nothing was really hitting the mark for them.
Well, it's pretty basic in medicine that you have to start with a good diagnosis. If you don't know what you're treating, then you're just shooting in the dark, and you might get lucky. But it's better to actually know what you're doing.
Exactly. I couldn't agree more. So, when we're talking about mold illness, there really is like this inflammatory soup of components of different things that we might be referring to, that when somebody is getting exposed to a water damaged building. So, could you elaborate a little bit on like what it is people might be getting exposed to that could be making them sick?
Well, it's actually kind of an inflammatory soup that people are getting exposed to. Probably the biggest player is mold itself, which consists of both mold cells and also fragments of mold, which are very irritating to the body. They trigger in the body a reaction of the immune system in order to fight this toxin. And by the way, it's the same process that we fight viruses or infections or COVID or Lyme. It's the same process where we make what are called inflammatory cytokines in order to fight it. And so these mold fragments, but also what are called volatile organic compounds, VOCs, mannans, proteinases, actinomycoses, all of those, it's really a complex biological, ecological, inflammatory soup that people are reacting to.
So, when it comes then to the mold toxins that people are getting exposed to, what is the best testing method for identifying if this is the case? Because there's different testing methods out there. There's blood serum antibody testing, there's urine mycotoxin testing. So what tends to be the method that you have preferred with your patients, and then also with the practitioners that you work with, and discussing with them what you consider to be the best method for identifying what's going on?
Right. There are a number of labs out there doing these measurements in different ways. The one that I and most of my colleagues have found to be the most accurate and consistent is the real-time lab, which is, and by the way, if I mention a product or a lab, I have no financial connection to any of this stuff. I've done thousands of these tests, and often split specimens where I'm sending the same specimen from the same patient on the same day to multiple laboratories to see which lab gives me the most information and the most consistent information. So when I use that name, that's the lab that's worked the best for us.
Okay. And earlier you were talking about, as part of that inflammatory soup, actinomycetes being something that people can get exposed to. Can you dive a little bit deeper into what actinose is, and is there a way to diagnose that somebody might be dealing with that, like on lab work? And then is there, on top of that question, is there a way to also treat actinomycetes if that is what somebody's exposed to?
Okay, that's a complicated question, and I don't think we actually know with real accuracy the answer to that. So although we know that actinomyces are part of the soup, and they're often nicknamed actinos, I have not found them to be the major player in mold toxicity. And I would say that's true for most people who work in the field. I am aware that one of my colleagues, Dr. Richie Shoemaker, has recently made a huge deal out of actinose as the most important player, and it can be tested for by several laboratories, and there are ways of treating it, but not well worked out, because actinos are a type of bacteria that is found in our body. In other words, in our root canals in our mouth, almost everyone has actinos. So there are dozens of actinose species. Only two of them, even by Dr. Shoemaker's work, have been closely associated with particular illness. And having worked in this, I've tried really hard to see if his observations are correct, and I just haven't found that what they've done with their patients has really helped them much at all. So, yes, that's being talked about. I may later be proven to be wrong, but we've tried to be looking at this as closely as possible, and I'm not sure that that's where people want to put their effort.
Okay. So a lot of what we want to, at least from your experience and what you've seen, is focusing primarily around if they're exposed, if this person has been exposed to a water damaged building, living there, working there, whatever their exposure route is, to be focusing primarily on mold toxins.
That's right. That's right. And very simply, one of the reasons that keeps proving itself over time is if we measure the mold toxins in a patient and we treat them and we get the mold toxins out of their body, that correlates beautifully with them getting well. So there seems to be the most direct correlation between measuring these toxins, treating them, getting them out of the body, and getting people well. So from my perspective, that's the one that's the most fruitful from a medical treatment perspective.
Thank you. Thank you for explaining that. So, when it comes to then treating mold toxicity, binders are important to add in based off of someone's urine mycotoxin panel just to identify like what we might be dealing with and then utilize the correct binders for that approach. But I'm curious your thoughts on, have you ever seen patients get better like not using binders but maybe using fiber binding, so insoluble fiber, focusing on gallbladder support, as opposed to, and maybe addressing the fungal colonization from mold versus like actually adding in binders? I'm just curious.
Rarely. It's not never, but rarely. If someone has a robust immune system and they get exposed to mold and it makes them sick, if they get out of that moldy environment, their immune system may be able to pull the toxins out of their body so that merely getting out of the moldy environment may be sufficient for them to get well. That doesn't happen a lot, and I don't see those people a lot. The people I'm working with are typically the ones who've been sick for years that have gotten much more complicated. But yes, I do think that that can happen.
So, when it comes then to mold colonization, have you found this to be present in most of the individuals then that you've worked with? And on top of that question, have you found a difference in using nutraceuticals versus pharmaceuticals for treating mold colonization?
I use both. I'm an equal opportunity practitioner. It depends on the patient, it depends on what they have, it depends on how colonized they are. And for your listeners, colonization means that when someone has been in a moldy environment for long enough, the mold actually starts to grow inside their body in the sinus and gut areas predominantly. So, and again, I deal with kind of the sickest of the mold patients, and the vast majority of those patients have colonized. Again, if you're lucky and you haven't colonized, just taking binders may be able to get you well. But for those who have not, they are going to need treatment with something that will help kill the mold, which is usually accompanied by candida, in the gut and in the sinus areas. So I use both natural materials and pharmaceuticals. It's my impression over the years that the mold is becoming stronger and doesn't respond as well to the natural materials. So more and more we've needed to turn to the pharmaceutical agents to really get the mold out of their body.
So, kind of going off of that, then, how long have I know every person's different depending on how long they were exposed to, how robust their immune system might be, or there's so many different factors, but what's like a typical amount of time that you've seen somebody get better in? Like, so like, in terms of like months or years?
The majority of people take at least a year, often more, to get well. It's important to understand that once mold and candida have colonized, they're very happy inside that body. That body is providing them with wonderful nutrients. The temperature is perfect. It's dark, it's moist, it's everything they ever wanted from a place that would be their forever home. And so they're not just going to leave the body because you don't want them there. You have to actually kill them and force them out of the body in order for the body to be able to bounce back and recover its immune function.
Hmm. So, when somebody's been exposed to mold, and if they've been exposed for years, there's a lot of nervous system dysregulation, potential mast cell activation, limbic system impairment that can be occurring as a result of that. And so, how do we distinguish between those three, between the nervous system, the vagus nerve being impaired, the limbic system, as well as maybe mast cell activation? Because they seem to be a lot of very similar type symptoms with sensitivities. So I'm curious your thoughts on that.
That's true, and largely we do it by symptoms, and partly we do it by testing. So the easiest test to do is to see how much of this is mold toxicity. And again, the urine mycotoxin test has been very easy to do. It's paid for by Medicare, for example, so it's like free in that particular category. And very simplistically, if you are peeing mold toxin into your urine, you're just getting it out of your body, and I pick it up on it by testing your urine, it's in your body. It has to be. And this correlates, as I said, very well with as treatment proceeds and people get better, the numbers get less and less and less over time. So that's our starting point. For, again, if people haven't had it for a long time, if it's fairly new, they may not have gone on to doing other things to the body. But if they've had it for a long time, almost all of our patients will develop what is called limbic dysfunction, vagal nerve dysfunction, and mast cell activation, all of which will make it even harder for that person to get better because it will sensitize their body and they will become less and less able to take the things they need to take to get well because they've developed those conditions. Now, those conditions have their own symptoms, which are a tip-off that, yes, that has occurred. The testing for those things is not particularly accurate, but the description is pretty spot on. So for the limbic system, for example, the limbic system is a part of our brains that its job is to keep us safe by scrutinizing the stimuli that we're responding to from the perspective of safety. And if our limbic system is not convinced we're safe, it's going to essentially shut us down and give us symptoms not to make us sick, but to warn us and say, hey, I don't think you're in a safe environment here. You got to do something about it. The limbic system's symptoms are in two main categories: emotion and sensitivity. So anyone who develops any sensitivity of any kind, that's almost by definition limbic. So we're talking people who have become sensitive to light or sound, chemicals, food, smells, EMFs, touch, almost anything that you can become sensitive to, that's limbic. If you also have a new onset or worsening of anxiety, depression, OCD behaviors, mood swings, depersonalization, derealization, any of those things, that's limbic. So when patients are describing that they're now anxious and they're depressed and their mood keeps swinging and they're sensitive to light and sound and chemicals, I know that their limbic system is impacted and I need to treat it. So if we shift our attention, what about the vagus system? That's a different part of our brain that gives us other symptoms. The vagus nerve goes to the heart and lungs and the entire intestinal tract. It controls intestinal motility. So any symptom that anybody has in which they have gas, bloating, distension, reflux, constipation, diarrhea, abdominal pain likely has a vagal piece to it. If they have palpitations, if they have temperature dysregulation, we're talking the vagus's role in the autonomic nervous system, so that those symptoms tell us, yes, the vagus is involved. And the vagus and the limbic system both work together to help keep us safe. So if there's a limbic piece, there's almost always a vagal piece. Now, if these things continue, then it's going to eventually trigger mast cell activation. And mast cells are types of white blood cells that are present in every tissue of our body, but particularly in the tissues that are directly exposed to the outside world. Our sinuses, our throat, our gut, vaginal areas, any place that's exposed to the outside world. We're monitoring those environments for safety, this time not neurologically, but on a cellular level. And when the mast cells become irritated or inflamed, and we use the word activated, they give us other symptoms. Now, mast cells make hundreds of biochemical mediators, the main one being histamine. And so if anyone tells me that immediately after eating, maybe while they're eating, they developed running nose, hives, itching, flushing, abdominal pain, fatigue, then nothing comes on that fast unless it's mast cell activation. So the speed at which something comes on is a hint that now we have mast cell activation too. So many of our patients, especially if they've had it for a while, we need to first treat the limbic and vagal areas, then mast cell activation. Then we can give them the binders and antifungals they need to get well. So it becomes more and more complicated the longer this has gone on.
So when it comes to, we have the diagnosis of mold toxicity and somebody is extremely sensitive, like with many of the symptoms that you've been describing, such as sensitivity to light, sounds, touch, EMFs, all those things, to where they won't be able to take the binders and the supports that they'll need because their body will just have a reaction. I've heard so many differing views from different practitioners regarding when to utilize limbic system training. And some practitioners really try to kind of get in and open up the drainage pathways and do all these different supports and then add in the limbic system after retraining after they've done the binders. But you're saying that we need to be adding that in first with the vagus nerve supports.
I am saying that as clearly as I can, and I never like to say that someone else is wrong and that I'm right. But in this particular case, patients will not be able to do the things that you're asking them to do. They'll try, and then the practitioner will go, well, this is so benign. Why can't you do that? Because they don't feel safe. And it's as if their body is on survival mode. And the body is going, that's all well and good. Yes, I need to open up my detox channels, but I'm not ready to do that. I'm not sure I'm ready to do that. Because if you do that, you're going to flood me with more toxin, which I'm really bad at getting out of my body. And this is not a good strategy. So I'm going to say as clearly as I can, the first thing you do if these things are in play is to work first on the limbic and vagal systems. When they're able to, add the mast cell system, and then you'll be able to do anything else you want to do.
Amazing. Thank you. And I mean, kind of going off of this storyline where the body is just feeling very unsafe, we can kind of talk about the cell danger response model. Now, I know we could spend a whole podcast, probably 2 podcasts, just literally talking all about the cell danger response model. So we don't need to dive into all the steps and all the stages of it. But I just kind of wanted to understand from your point of view with working with so many different patients in this area, do you address the cell danger response as well? Like, does the nervous system play into that, or is working through like various aspects of where somebody might be along this process? Like how does the cell danger response model by Dr. Robert Navio like fit into all this?
So it fits in perfectly to what I'm saying, which is the cell danger response, if I can oversimplify it, is on a cellular level, if a cell feels threatened, it goes through this organized, orchestrated process to protect the cell and let the rest of the body know, hey, we have a problem over here. Let's get all of our protection devices in order and let's work on it. There are three main things that trigger a cell danger response: toxins, infections, and stress. And for many of our patients, they have all three. So mold toxicity fits directly into that model. So on a cellular level, when we know we have mold toxicity, the cell essentially shuts itself down so that it is minimally affected by the toxin until we can get rid of it. And it's not going to allow you to do anything until it feels safer. This is still in the same mode, which is, and you can't convince the cell, oh, poor cell, really you're safe, we'll protect you, we'll hug you. Um, the mitochondria are the organelles inside the cell that are what determine that safety. And you can't fool it. If you're still mold toxic, we're in danger response. We're not going anywhere. If you're infected by an infection like Lyme disease, we're in danger. We're not going anywhere. So the cell danger model is a perfect way to understand the order in which you need to do the things you need to do for people to get well.
And kind of playing off the CDR model. So in your book, you talk about your recent book, you talk about thiamine deficiency and how its role with the mitochondria and how it could ultimately play a role with the cell danger response. So, are there specific symptoms that people, practitioners, can look for in individuals with thiamine deficiency, and like how do we can we test for it and how do we support it?
Um, thiamine deficiency has been found to be a particular deficiency in many of our patients who are ill. It's also called vitamin B1. Um, in mold toxicity, it turns out that mold toxin messes with the body's ability to absorb or utilize that vitamin. So it is a particular target for that. It's also depleted in people who take metformin, which is 4 million Americans are taking metformin for treating their diabetes. That's not to say metformin is not a great medication, it is. But you're going to become thiamine deficiency if you keep taking it for a long time, as a likelihood. So many of our patients need to be aware of that. The number one symptom that you'll get when you're thiamine deficient is fatigue. Thiamine is a major cofactor in what we call the Krebs cycle, which is the way the body makes energy. And if thiamine is deficient at almost every stage along that cycle, we're blocking it so that the body can't use its normal mechanisms to make energy. So the number one thing that people are going to find is fatigue, sometimes connected to what's called PEM, or post-exertional malaise or myalgia, where I often see that as a symptom. It also affects the immune system. It affects, surprise, it affects the vagus nerve, and it affects the limbic system. A particular symptom which sometimes is found in people with that deficiency is ataxia, which is a neurological condition in which you can't walk a straight line because your balance is thrown off to the extent that you aren't orienting yourself in space and time properly.
So with some of those symptoms with mold toxicity, we're suspecting that they're deficient in B1. So is supplementing with so then the treatment then is supplementing with B1, correct?
Yes.
And utilizing that with the patients. Okay, amazing. So let's say that somebody's gone through their limbic system retraining, they're supporting their vagus nerve, they've supported mast cell activation, they've opened drainage pathways, they're detoxing now, and they're doing pretty well. But then maybe they aren't responding super well at some point in their treatment, or maybe they're not responding at all, you mentioned in your book maybe to look into structural issues. And so I'm curious about maybe talking about dental work or like jaw misalignment as being a potential reason why.
Sure. And I do want to say that the number one reason why patients aren't responding to treatment when you're doing all the right things is that they're still being exposed to mold somewhere at home, and at work, in their car, at a relative's house that they visit frequently. Um, re- Ongoing mold exposure is, without any question, the number one problem here, and um, probably the most difficult, expensive, and problematic component of treatment, because you're not going to get well if you stay in a moldy environment. And this is financially, socially, and in every way super difficult for a lot of our patients to either be able to afford to remediate their homes or to be able to afford moving. So this becomes the number one blockage point in healing. I just really want to emphasize that, because if someone's not responding to what I'm doing, the vast majority of the time, that's the problem. And it can be really difficult to find where in a home that's coming from. We don't really have the tools yet to perfectly, sometimes even adequately, figure that out. And so many of our patients are super frustrated because they've taken apart part of their home, and at great expense. And it's still obvious that they're mold toxic. They get out of the house, they feel better. They come back into that house, they feel worse. It's pretty clear that it's the house. And that, but finding out where can be tricky. It can be hiding inside a wall or under a tile, or coming in into the house from a crawl space or an attic or a garage that's affected. So it can be tricky to figure that out. But so coming back to your question, another reason that patients don't make progress is, and this may sound odd, but I'll try to explain it, is because of the physical structure of their face and jaw. Meaning their jaw is out of alignment and the teeth aren't occluding properly. For some reason, I have no idea what it is, the body prioritizes the sensation that your teeth have to come together properly. When they don't, it freaks out, and it will move heaven and earth to try to find a way to get that jaw back into alignment so that you can be comfortable again. So this is a little bit like a limbic issue, where the body's trying to tell you that it needs some help here. And not for a lot of patients, but I've had several dozen where until they could get their jaw aligned properly, they couldn't even respond to limbic or vagal work. So it can be, for some people, an issue. For many people, the rest of their structure, their head, neck, bodies, also comes into play. There's a particular issue, again, happily fairly rare, called CCI, which is craniocervical instability, where at the base of the skull, where the skull connects to the first cervical vertebrae, if that area becomes out of alignment or is collapsed because of weak ligaments, it compresses the nerves, the arteries, and flow up and down through the head. And again, that becomes a priority for the body, like the jaw. And until that gets fixed, some people cannot respond to treatment until that gets addressed.
With that cervical instability, now is that what can lead to what you refer to in your book as spiky leaky syndrome?
Yes, but the word spiky leaky is the name given by the co-authors of that chapter who developed the concept. It's not in general use yet, but it should be, because it kind of describes what's happening. The more common word, more generally used in medicine, is CCI, craniocervical instability.
Okay, thank you. So, with mold exposure, there's a lot of downstream effects, as we've been talking about, that can be occurring in the body from the inflammatory mediators and everything that's getting released, and hormones that can be disrupted, like such as our adrenal glands and our thyroid glands. So, I get this question a lot, and I was curious your thoughts on it. Where when we're treating somebody with mold illness, where along their journey are we kind of maybe supporting their adrenal glands or their thyroid glands, like, or are we waiting until closer to the end until we've gotten rid of most of the mold toxins? Like, have you found a place like to support those areas like sooner rather than later?
Yeah, sooner rather than later. Um, it's Mold toxin messes with the pituitary's ability to regulate our hormones. And the ones most affected are the ones that are really important to us, like thyroid, adrenal, sex hormones. Those are the biggies. So it doesn't make sense to me to ask someone to suffer for a year or more until I get the mold out of their body, when I can, at least to some extent, balance those hormones from the get-go. So as soon as we discover that hormones are out of balance, it will help that patient heal faster and feel better if we can get them balanced. Now, we can't do a perfect job of balancing them because we're going to be hitting a moving target. As mold toxin levels fluctuate in the body, the pituitary will have a varied effect from that. So you can't make it perfect, but you really can make it better.
Awesome. Thank you. And what are your thoughts on using lipids for mold recovery? So, like phosphatidylcholine or adding in like fats, like for every meal. Like, have you found that to be very helpful for your patient population?
I'm very fond of phosphatidylcholine. As listeners probably know, it is a major constituent of every membrane in the body, and helping the membranes become more fluid allow those membranes to get rid of toxins which are bound to the surface of those membranes. So I'm a big fan of phosphatidylcholine. It works infinitely better intravenously if you can get someone to do that for you. Um, it is it can work orally, but you have to take a whole lot of it to make that happen. However, phosphatidylcholine also helps the body make a better quality of bile, and we use bile to bind these toxins and get out of our body. So it has other purposes and uses that are helpful here.
I love it. I love phosphatidylcholine too. So, another thing that you had talked about in your book that I really loved was patients can get stuck along their journey from recovering for multiple reasons, like we've been talking about. But one of them, you were saying, maybe look beyond the physical plane and look more into the spiritual, energetic realm side of things. So I was just hoping that maybe you could expand on that for the listeners.
The body is a unity of mind, body, and spirit. I mean, those, what that means is right now we're breaking it apart, and I'm talking about the physical component of things. But the physical never happens in a vacuum. There's always an emotional and spiritual component to any illness. Simple one, take pneumonia. If you had pneumonia and you're having difficulty breathing and you're coughing and feeling horrible, it has to come with fear and anxiety, which is, how long is this going to go on? Is my breathing going to be shut down? Is this going to kill me? All kinds of important, serious questions come along with it. If you're sick for a long period of time, and most of my patients are, it really messes spiritually with what gives their life meaning and purpose, which I view as the heart of spirituality. Meaning, I love my work and I love my job, but I don't think I can keep doing it. I'm too anxious and fatigued and cognitively impaired. I'm going to hurt someone at my job if I try to keep doing it. So am I going to lose my job? Am I going to lose what gives my life meaning and purpose? So all of these things are always in play. We don't always talk about them in the beginning, but at some point, as we're working with our patients, it's really important to know how they're being impacted in all of these areas. And for some of our patients, some of their previous life experience will make this more difficult. So it's well known that patients with more severe chronic illness have earlier in their life experienced more trauma. That's not a surprise because it means that their limbic system has for throughout their life gotten more and more and more hypervigilant. They feel less and less safe. Life is more and more difficult for them as they try to cope with life. This impacts the immune system, so that patients whose immune system is being impacted by all these understandable stresses. I mean, it's not like you can't choose your childhood. It's just how it is. And some of our childhoods are better than others. Nobody has a perfect childhood. Nobody's needs got met perfectly in childhood. So to whatever extent they didn't, our limbic and vagal systems have kicked in to try to protect us by helping us scrutinize the situation we're in and protect us by doing whatever it takes for us to get where we are right now. And so in that process, um, our immune systems may take a hit, and we're more prone to these things. So for some people, they need to do whatever it takes to heal some of these traumas that may go back to childhood in order to be able to make progress. They have to get safer in order to be able to even respond to the limbic and vagal strategies that I'm talking about.
Thank you. Thank you for talking about that. To kind of tie everything together then with the vast amount of patients that you've worked with in, mold illness, Lyme disease, everything dealing with chronic illness, is there something particularly with mold recovery that you have found to be consistent over and over in the patients that you worked with and the ones that maybe had gotten better the quickest or just ended up getting fully better? Like what was kind of is there like a common denominator that you've seen?
That's an interesting question. Um, Number one, the patients who do the best are the ones who just keep plugging away. The ones who, and Dr. Joe Brewer found that early on in his research, where the patients who did the best were the ones who took the medications consistently. And I will add to that the ones who are working on their limbic and vagal systems and mast cells consistently, because it's not like you do that for 2 months, get better, and we're done with it. As long as there's mold toxin in the body, it's going to keep triggering these things. So this requires diligence, discipline, commitment, and the folks who approach it from that perspective by far do the best. The ones who have the most difficulty are the ones who have what I will call an unrealistic expectation. Like, okay, I'll do a couple of binders for a month, and then if I'm not better, I'm throwing in the towel. Well, forgive me, but that's not going to work. That is not an adequate approach. You have to do the whole treatment program. It's an entirety, depending on what your body needs. And if you can come to the table with the most amount of optimism that, yep, this is going to work, I'm going to get my life back. And honestly, I've successfully treated 4,000 or 5,000 people with mold toxicity who've completely recovered. So the message I want to leave people with is not to be terrified by everything I've said, but everything I've talked about is treatable. So that's the bottom line, which is you can get your life back if you have these conditions. But it's important that you understand the bigger picture of what needs to be done for you to get well.
Thank you. And that was a very powerful message for a lot of people to hear. And my hope was that you probably were going to talk about that consistency and diligence, but then also coming to the table with that optimism and understanding that you can get better, but it's just a matter of plugging away, like you mentioned. Because when you look at it from the outside looking in, it can seem very daunting and look like a lot. But if you just come in with the exact same attitude that you mentioned, right? It's so powerful, and it can really fast track you to getting better and to achieving and getting your life back. So thank you for mentioning that, because that's really powerful words.
And it beats the alternative, which is it might be daunting. Yes, this is a somewhat complicated, bordering, overwhelming treatment program. There's no question about that. It is. But the alternative is to stay sick from mold toxin and get worse and worse and have your whole life and that of your family and everybody you know get ruined because you can't function anymore. So mold toxicity is a really nasty illness. It is not a benign, it's not like mold allergy, which is okay, I'll take a decongestant, I'll deal with it. This is a systemic, total body um, process that, once understood, we can treat. So please don't get daunted by what it takes. You should be more scared about staying sick with it because, to be honest, that is the worst case scenario.
And I love that you also had mentioned the limbic system and the vagus nerve piece as well as being a very important part, because that is truly what I believe is needs to be added in for most individuals going through this process, as you're mentioning. And I love that that's something that you keep coming back to. So thank you so much for your time, for this great information that you shared with me and the listeners. And I'd love to just leave it to you if you have any other words that you'd like to mention, as well as where people can find you and if there's anything that you're working on right now.
So you can find me at my website, which is very simply www.neilnathanmd.com. Not complicated. If you want to know more about this, you might want to, at the risk of being self-serving, mention that you might want to read my book Toxic, which goes over this in a lot more detail. For the people who've gotten sensitive, my newest book, which is called The Sensitive Patient's Healing Guide, goes over this in much more detail, which is, we didn't really get into the how-to, but those books go into the how-to in much more detail. So those may be very helpful for you as well.
Thank you, Dr. Neil Nathan. Really appreciate your time today.
Thank you for having me.